Hello, everyone, and we are so excited to bring you some more amazing content for Lipedema Awareness Month. I'm Brenda Viola with Lympha Press, and this is part of Lympha Press Educational Webinar Series. We were really honored earlier this month to host Dr. Karen Herbst, who spoke on compartment syndrome. She had done this at the FDRS conference in April. There was another presentation that created such a buzz in the room, but she was only given 15 minutes at FDRS, and we understand for time constraints, but we said, oh, we need to give this a platform where this information can breathe a little more. So we are so honored to have with us Linda Ann Kahn. She is speaking on the issues are in the tissues. It's a journey into the fascia, the vagus nerve, and the effects on connective tissue disorders. We see that you are all logging on still right now. So let me do a bit of housekeeping before I give you the floor, Linda Ann. We are recording this webinar. Do not fear. There will be so much information. You'll be like, I want to watch this again. I don't think I can get it all in one sitting. So yes, it will be recorded. For everybody who has registered, you will receive a link to the replay. Also, if you subscribe to the Lympha Press YouTube channel, subscribe, you will get an alert as soon as this goes live on YouTube. And of course, it will live forever and ever on the Lympha Press website, lymphapress.com. We hope you will have questions. We want you to ask them. We've packed in time at the end of the presentation to handle them. So please do put them in the Q&A. And for right now in chat, let us know you're here. Let us know where you're logging in from. And we want to say hello to you. We thank you. We know you've given time in the middle of your day to be here with us. And so with that, I am going to say Marty Klein is already out there in the house. We love you, Marty Klein. You're such a supporter of all of our endeavors here at Lympha Press. Carol Moody's here, our friend Roseanne, Lonnie, Becky, Leslie, Ginny, and they keep logging on. So we hope that you are ready. Buckle your seatbelts, because I tell you what, Linda Ann, when I heard this at FDRS, I was amazed. You didn't have one pause or because you knew you had 15 minutes and you just hit the ground running. So we can all breathe a little bit. And I'm excited to hear this again. Ava, Andy, Carner, Fiona, Casey's here, Blaze, so many wonderful people. Linda Ann, I'm going to disappear. Please take it away. We are honored to have you present today.
Hello, everybody. I'm so excited to be on this platform for Lipedema Awareness Month. Those of you who know me know that I have been a lymphedema therapist for over 35 years, believe that or not, and that I do have lipedema stage 1. So I'm extremely passionate about helping patients with lipedema. And for about the past 2 years, I've been fascinated by the fascia and the emotional aspects of this illness. So we're going to touch on a lot of that. Some of the slides may look like they're repetitive, but I'm going to say them in different ways because there's a lot to absorb. And definitely the issues are in the tissues. And we are a whole person. Everything is connected. And I'm going to show you that. We're going to talk about the fascia and the fascial network, the effects of trauma in the tissue. And we know that lipedema patients have a lot of trauma just from the disease itself, or there's been adverse childhood events, but just the trauma of lipedema can create many, many problems in the tissues. We'll talk about the vagus nerve and how it is affected by stress and trauma and how it impacts the body. I want to talk about heart rate variability and draw from heart math and resilience and coherence, because we need to be resilient. We go through so many hard times and difficult times and ebbs and flows in our life, but resilience is where it's all at. So we're going to touch on that. And then the limbic system. And of course, when I talk about the limbic system, there is aromatherapy. I am a clinical aromatherapist as well, and love to share about that and integrate it into what I do. And then we will end with exercises to tone the vagus nerve. When we tone the vagus nerve, we are calming the entire sympathetic nervous system, particularly the parasympathetic nervous system. So briefly, what is lipedema? We all know what that is, but I just wanted to mention a few things because we'll be touching on things within this lecture that will affect some of these items. So lipedema is an autosomal dominant loose connective tissue disease. It's present predominantly in women. There are increased nodular and fibrotic adipose tissue within that, and that is causing a terrible problem, and that is in the extracellular matrix, which we're going to talk about. There's painful increases in the fat, and there's interstitial fluid in the limbs, although some people are saying there's no fluid, but we do believe there is fluid in the limbs. We're going to be addressing the pain in the subcutaneous fat. And most patients experience painful symptoms, and 84% have pain with palpation. And so we're going to address that. And there is secondary lymphedema and also fibrosis during later stages. Again, the fascia have been affected with that. And from all of that, mobility is impaired. And there is extracellular matrix remodeling. And within the tissue, we find nodules, lipomas, and structures that feel like grains of sand or like rice. When we palpate to actually do a diagnostic, that's what we test for within the lipedema tissue. And then we know that non-lipedema obesity is present. It can progress to lymphedema, and there's venous disease and hypermobile joints. Those are some of the comorbidities. So these are some of the challenges that patients have, that we're going to be addressing some of them within this lecture. Pain, decreased mobility, which is absolutely the fascia tightening in addition to the joints being painful, and that will affect gait. Anxiety, trauma, isolation, depression, hopelessness, that I hear almost every day in my practice. Hopefully, after patients have been to me for several visits, that trauma and isolation and depressing is lifting. And also being part of Lympha Press and the lipedema roundtable and being part of a community can definitely help with those feelings. There always is body dysmorphia, even for stage 1 patients, and then joint pain. When we're working with our patients, we need to have more than the standard complex decongestive therapy. We have to have an integrative approach and affect the psychological, emotional, physical, and spiritual aspects of this disease and help our patients with self-care to manage their emotions, anxiety, and pain. And that is what prompted me to actually have this lecture and start studying about it and talking about it. So again, we're going to discuss the fascia and how the trauma is stored in the tissue. We're going to explore the connection. I don't know if you know, but there is a connection between the heart and the brain and the vagus nerve. And that all relates to Dercum's and lipedema and also mast cell activation. And actually the messages from the heart to the brain, there's more of those than the brain to the heart. Messages from the gut to the brain, there are more of those than from the brain to the gut. Very interesting when you really look into all that. We're going to look how trauma is stored in this extracellular matrix, and we're going to explore the extracellular matrix, which is part of the fascia, and the role of the autonomic nervous system, parasympathetic and sympathetic activity, and how chronic emotional stress and the emotions affect myofascial pain. And I'm sure all of you who are patients understand this chronic emotional stress. And attendees are going to learn specific exercises and tools to calm the vagus nerve, which then will reduce inflammation and sympathetic activity and help to relax the mind. And we want to shift into a more coherent physiological state before, during, and after challenging or adverse situations. And so that is what our goal is. That is what my goal is in helping my patients. When I have a lipedema patient come to me, I want to educate, I want to treat, and I want to help the patient to get into a more coherent state and be more resilient with their condition. So the fascia, it's just long overlooked, and it really does shape our health. It's a 3D, uninterrupted and interconnected system. And I'm going to be repeating that in certain slides because I want you to understand that the fascia is connected, and what happens in one part of our body connects to another part. Your neck can be sore, it can be coming from another part of the fascia. It spans our entire body, and it infuses with muscles, bones, nerves, brain, and vessels down to the cellular level, which is amazing. And there are sheets of white fibrous connective tissue, which are very strong, and they keep the muscles and the organs in place. And usually in the anatomy books, you don't see the fascia because it's been carved out. It's white. You can see it in this picture over there. I was fortunate enough to be in a dissection laboratory and actually examine the fascia. It was the most exciting thing, which was just a few months ago. So it's this tough connective tissue. It spreads throughout the body, and it's a 3D web from head to foot without interruption. This is a body in motion to show you how this fascia is moving and part of all the body parts. And it has tiny hollow tubules that are filled with fluid, and that's carrying all the information surrounding everything and every organ of the body. The fascia does play a role in interpreting pain and increasing cellular efficiency throughout the body, which is crucial for optimum health. And there is thermal, electromagnetic, and mechanical energy, which helps all aspects of the mind-body. And there can be a myofascial release for healing on very, very deep levels. Trauma, surgery, or inflammation can cause a malfunction of the fascial system, and then everything binds down, and there's an abnormal pressure on the nerves and muscles. My teacher, John Barnes, has a lot to say about this, and when you have myofascial release sessions, that you can actually see and witness this release of the trauma that has been in the tissue for sometimes for years and years and years. Because these restrictions exert tensile forces on the fascial and neuromuscular, skeletal, and pain structures. This pressure, believe it or not, which is approximately 2,000 pounds per square inch, can create symptoms of pain and decreased muscular tone. We don't know why there is pain in lipedema tissue and Dercums. We haven't really known the proper research yet, but this could be a huge part of it. We have so much more research to do. Myofascial restrictions do not show up with any of the imaging that we do. Recent research has shown an association between increased fascial thickness and reduced joint flexibility in patients with chronic pain. And the whole time that I'm talking, I want you to relate this to the lipedema that you have or the lipedema patients that you work with. And so the further study, they delineate the cause-effect triangle of body mass index, flexibility, and fascia thickness. We need to have more studies to look into that. Carla Stecco is an amazing woman who's one of the leaders in fascial, the fascial fitness and the fascial world. She's one of the authors. And then we have tensegrity. I love that word, tensegrity. And it's the talking about the structure, the function, and the integration. And you can see in this picture at the top, when we pull the skin on the Spider-Man, the skin on the top also pulls. Everything is connected. The fascia are connected. And you see that tensegrity model at the top. It's like the scaffolding in a building, and if one part goes, everything will collapse. And that's just how the fascia is. It's holding everything up in the body. The bones are floating in the sea of soft tissue, held in position by tension from your muscles and the fascia. And it's like the balance of tension is all over the body. And as I said before, damage in one area can cause pain in other reasons. areas, even though they may appear to be unrelated. This is Freya on the left side. This is a plastinet model that was made, and there is an exhibition in Germany, and I will be going to Potsdam near Berlin for the first ever World Lipedema Conference, which is going to be held in October, and I'm going to go to the museum to see Freya in action. My instructor who taught me the class where we were doing the dissection of the body, she played an integral role in dissecting for Freya. So there's a lot of exciting things happening right now. This is the skin, which when you look dissection, it's so thin. I'm an esthetician in addition to everything I do, and I've worked on skin for so many years. It's so thin. The lymphatics are just below the surface of the skin. And then we have the SAT, which is the superficial adipose tissue, and this thin layer called the superficial fascia, which I was blessed to actually see on a human cadaver. And then we have the deep adipose tissue, and underneath that is the deep fascia, and then the epimysium and other structures depending on where in the body this is. And then we have the muscle. It's tough, it's connective tissue throughout the body. Again, I repeat, it's a three-dimensional web which goes from head to foot without interrupting. Think of that picture that I showed you of the man there with all the web. It's a rich sensory organ. Did you know that? The fascial network is a rich sensory organ. And you'll notice now, I'm not just talking about the fascia, I'm talking about the fascial network. It's a rich sensory organ. There are 250 million nerve endings. The skin has 200 nerve endings. This has 250 nerve endings. No wonder when there is constriction, we have pain. And that trauma, posture, or inflammation binds down on the fascia, creating this pressure on the nerves, blood vessels, and bones, or the organs, because the fascia surrounds the organs. When I asked John Barnes, we spent an hour and a half talking about the brain and the head, and he did not mention the gliolymphatic system. And so I asked him, and he said that all the lymphatics are surrounded by fascia. So it's still what we're talking about. Fascia is everywhere. And the fascia restricts with trauma, with poor posture, stress, and/or inflammation, resulting in pain, tension, and poor health. Now we know that the emotional energy that we have not released gets stuck in our tissues. We need to work on those tissues, on the extracellular matrix, on the connective tissue, on the fascial network to release that energy. And then we can really help our body. When we have lipedema and Dercums and mast cell activation, there's a lot of emotional energy. There's a lot of unknowns. There's a lot of activities that people can't do. And that emotion gets stuck in the tissues. And many of my patients have had what we call adverse childhood events. So your fascia is inherently linked to the autonomic nervous system. There are two studies over there that you can see. There's sensory nerve endings, as I mentioned, 250 million receptors. And then there's not proper communication with the nervous system when there are these restrictions. And then there's inflammation, and the toxins and scars can cause adhesions in the fascia. So when you work with your lymphatic therapist, not only do we do lymphatic massage to calm the nervous system and parasympathetic nervous activity, but we can help to reduce scars and help to rid the adhesions in the fascia through different tools as well as our hands. And we hope that we then will resolve these unresolved psycho-emotional conflicts that have been stored in the fascia. And emotional stress may influence myofascial pain, and you can look up these two studies showing that and how physical and psychological traumatic events will help to develop fibromyalgia, and many of our patients do have fibromyalgia. So I want to summarize that when your fascia is tight and constricted, the emotions do not flow. Your nervous system relies on a fluid state of the connective tissue for proper communication. and for proper muscle contraction and for movement to occur. Think about how you are now. I'd like you to just breathe in. Think about your neck. Think about your shoulders. Are they tight? How did you feel when you woke up this morning? Were you upset about something last night? Can you still feel it in your tissue? I want you to really tune into all of that and understand that the connective tissue and the autonomic nervous system are connected because there are free nerve endings in the fascia of the extracellular matrix that activate the same area of the brain that helps perceive emotions and internal well-being. And we're going to talk about how the vagus nerve actually links into all of this, because that vagus nerve begins at the base of the skull. Chronic emotional stress may exert significant influences on myofascial pain. Chronic pain and psychological distress frequently coexist. Psychological and social factors worsen the patient's quality of life and then make the existing pain even worse. Some of my Dercum's patients are in chronic pain, and I have one patient right now who has not been able to have his pain medication renewed, and he lives in New York, and his wife had to actually take him to the emergency room because he was so dependent on these medications, and the pain was so bad from the Dercum's. It's a very advanced case. And I know that he's constricted, completely constricted from all that pain. And so psychological factors such as pain, anxiety, not knowing what's coming next, do contribute to these myofascial trigger points. And there are myofascial trigger points all over the body that can be worked on. And hopelessness, depression, anxiety, and stress can also contribute to this stress and holding on in the tissue and having negative emotions. Tervel is a very famous person who I studied when I was very first in massage school, working with all of these points on the body. The fascial network, as I told you, it's our richest sensory network, and there's chronic sympathetic stress activation induces activation of T3 immune cells in the lymph nodes and can also induce a stiffening in the fascial tissue because of the adrenaline, the cortisol that is released when the sympathetic nervous system is activated. And that will cause myofascial pain. Are you beginning to see what I'm saying? But look at that. Look at that. It's a magnified look at the fascia. It's a network. It's a spider vein all over the body, just like the Spider-Man little picture that I showed you. And there are three-dimensional tubules, which are filled with liquid gel, polysaccharides, and fluid. It gives functional structure to the body. The people who are in the Fascial Society have redefined the definition of fascia because it was too complicated to just give it one line. So what they're saying now, that it provides an environment that enables all the body systems to operate in an integrated manner, and it comprises of adipose tissue, the adventitia and neurovascular sheaths, aponeurosis, deep and in this deep and superficial fascia, which I showed you in one of the pictures, joint capsules, ligaments, membranes, meninges, myofascial expansions, periostea, reticula, septa, and tendons. Those are all part of the fascia. And then visceral fascia within the organs, and intramuscular and intermuscular connective tissues. That's a lot to say, but that is really one of the new definitions of fascia because it is so involved and it does incorporate all of this. Now, when the fascia doesn't glide, the nerves become trapped. It's supposed to be moist and liquid and gliding and moving, and when it doesn't, there's pain. For example, sciatic sufferers have the layers of the IT band stuck together around the level of the hip. And when there is rigidity between the layers of the deep fascia, it's sometimes called fibrosis or scar tissue. And we know with lipedema there is fibrosis, and there are these little fibrotic tissues and nodules within the tissue. You have all learned how to do self-care at home to help with that fibrosis. So, fascia and dysfunction. Fascia at the cellular level creates the interstitial spaces, and their support, protection, separation, cellular respiration, and it even helps with lymphatic flow. But when that is tight, lymphatic flow is not functioning at its optimum. And any trauma or surgery can set up the environment of poor cellular efficiency and pain and dysfunction throughout the whole body. So sometimes one has to have surgery, very important, to do your myofascial release afterwards, to do manual lymph drainage afterwards, and self-care techniques. The extracellular matrix. When I was in school in 1992, training as a Dr. Vada therapist, we learned about the extracellular matrix. But we have now learned so much more about this extracellular matrix because we know that it's three-dimensional. We know that the fascia is in there, and it comprises of collagens, different kinds of collagen, type 1, 2, 3, 4, 5, proteoglycans, glycosaminoglycans, elastin, fibronectin, laminins, and other glycoproteins. That's also lots of words, isn't it? And these together form this complex network where the cells reside and communicate. And there are two main classes of molecules in the extracellular matrix, and they are fibrous proteins and aqueous compound, which is the ground substance. These are words that you will see popping up all the time in some of the studies. I love studying, I love researching. I find a research study and then I look at all the references and then I look at that, and then you can put a whole picture together. We've got so many new studies now. This study was in 2023 on the extracellular matrix and the immune system and how it is a mutually dependent relationship. And that this network has an intricate relationship with immune cells and the fascia. So it's very important as we age for wound repair, fibrosis, and also for aging. I love this picture, but we won't have time to talk about everything on it, but it just shows the extracellular matrix comprises a third of all tissues, and it's very important in the immune system as a response to infection, antimicrobial activities, macrophage activities, which is also to do with inflammation, phagocytosis, leukocyte population, which is the white blood cells, and regulation of inflammatory networks, which is important for our particular population. Pain. Who knows about pain? Who knows that when you're stressed, the pain is worse? Who knows that when you're stressed, you're more inflamed? The fascia is innervated by the sympathetic nervous system. So when you have pain or when you are really stressed, it will produce a vasospasm and there'll be ischemic pain in the blood vessels. That then affects your posture and your walking. And of course, it can be a tremendous physical or emotional pain and discomfort. If your fascia is constricted, whether by injury, scars, stress, trauma, inflammation, or illness, the flow of energy, wisdom, communication, and movement between your body's interwoven system gets disrupted. If you would please take a picture of that so that you can have a deep understanding of what this fascial system is in our body and how important it is. A combination of mental, emotion, and physical stresses alter the neuromyofascial and skeletal structures, creating an identifiable change, which then generates further stress, such as pain, joint, and general discomfort and fatigue. My teacher, John Barnes, is now 84, 85, and he is still teaching. He's amazing. When you have myofascial release, it is a treatment to help with unresolved trauma that has been held in this interstitial extracellular matrix, where the tissue memory is held. The myofascial system is the record keeper of memory in the body-mind complex. And when trauma occurs, whether physical, mental, emotional, or a combination, people respond with a fight or flight or a freeze response, which we're going to talk about in a few slides. In this freeze response, we cannot heal properly from a traumatic event. It has to be dealt with. Myofascial release helps with the trauma and helps to release restrictions that are held in the body. Your parasympathetic nervous system controls that rest and digest, or the sympathetic fight or flight. So you have the sympathetic nervous system, which is your stress, fight or flight, your parasympathetic, which is your rest and digest, and the vagus nerve is connected with the parasympathetic nervous system. That makes up your autonomic nervous systems and controls all of your involuntary body activities. And this has a direct link to your connective tissue. And so that link is through the vagus nerve. And the vagus nerve starts at the base of the brain behind the head. It goes up to the head, surrounds the ears, it innervates the ears, and then it goes down the neck where we work with lymph massage, goes directly round all the organs and into your gut, and plays a major role in the parasympathetic nervous system. It controls heart rate and many other functions, and it's also responsible for digestion and immunity. It's one of the most important nerves for maintaining mental health. Why have we not been talking about this years and years ago? Why is this not taught in all the schools? There are afferent fibers, and the afferent fibers will go from the gut to the brain. And 80 to 90% of those fibers are afferent, they go to the brain. And 10% of the vagus nerve fibers, which are the secretion of gastric acids and enzymes, go from the brain to the body. And the vagus nerve is influenced by relaxation techniques, by nutrition, and there are many disorders that affect the vagus nerve. So signals from the digestive system and organs to the brain and vice versa is what the vagus nerve does. It is the 10th cranial nerve, and we call it the wanderer nerve because it wanders in so many parts of the body. It'll control your mood, your immune response, digestion, and your heart rate. And the vagus nerve, as I said, it's the wanderer. It's the main nerve of the parasympathetic nervous system, affecting all the body functions like your heart rate, your digestion, your immune system. When you say, I had a gut feeling about something, I could feel it in my gut. I've said that many times during my life. You really could feel it because this is the 10th cranial nerve and it innervates into the gut. So the gut-brain connection is very, very important. And this will influence your heart rate and respiratory function. And it's one of the connections of the brain and the gastrointestinal tract, which sends information about the state of the inner organs to the brain via afferent fibers. The brain receives a lot of this information. Dercum's, lipedema, and Ehlers-Danlos patients experience gastrointestinal symptoms, depression, anxiety, and memory or concentration problems. When we activate the vagus nerve, we can accelerate the body's anti-inflammatory response by calming the nervous system and lowering the body's production of inflammatory cytokines, lowering inflammation, which is what really is key for us to do. Recently, there's been an identification of the cholinergic anti-inflammatory pathway, and now there's a new interest in the parasympathetic nervous system and how that regulates immune response. Vagus nerve stimulation, or toning we call it, may also help to reduce stress and decrease mast cell activation by lowering histamine release and helping gastrointestinal issues. Many of our patients have mast cell activation. Can you begin to see now how this is all tying together? That's one of the things I love to do, is to integrate and see how this connects together, because we are a whole person. And we can stimulate the vagus nerve and send a message to our bodies that it's time to relax and to de-stress. And that will help mood, pain management, well-being, and resilience. Very important tool for lipedema patients and for everybody undergoing stress. Recent evidence shows that the nervous system interacts dynamically via the vagus nerve with the intestinal immune system to modulate inflammation through the humoral and neural pathways. The mind and the body are connected through the vagus nerve. It is the longest nerve in the autonomic nervous system. It's the internal control center, allowing the brain to monitor and receive information about many of our body functions. And you can see this chart here: cardiovascular, esophagus, ingestion, adipose tissue, metabolism, inflammation, digestion, respiration, and balance. Lipedema and Dercums have a significant impact not only on the physical body, but also on emotional and mental health. Depression and anxiety do occur at higher rates with lipedema and Dercum's patients, unfortunately, and that causes stress, which creates more release of cortisol, which then creates anti-inflammatory state. NF-kappa B is released, interleukin-6, and all the inflammatory states are there. Vagus nerve signaling or toning, I've mentioned it a few ways. You can call it signaling or toning or stimulating, can reduce inflammation and help with mood, because it communicates between the brain and the gut and the immune system. And these sensory nerve endings in the connective tissue transmit the pain signals, as I've been telling you. And we know that patients with connective tissue disease, such as EDS, Dercum's, and lipedema, have chronic inflammation and pain and experience stress and anxiety, which then can lead to the mast cell activation. So it becomes really key to work on this vagus nerve. I just came back from the most amazing trip to Europe. I was in Eastern Europe, and we were running through the airport at London Airport, Heathrow, running for 25 minutes. And then we got there and they had just closed the gate. They wouldn't let us on the plane. I had my husband doing deep breathing for his vagus nerve. He looked at me as if I was nuts, but we did 3 deep breaths and it just calmed us down. I'm serious. So you can see the spider web over there. And we know stress is emotional energy that you have not released. Stress and emotions from your past, which are stuck in your joints, tissues, organs, and fascia, and that stagnates in the body. And then your energy doesn't flow. And when there's constriction, your breath and your energy, everything constricts in preparation for an attack. And then the vagus nerve won't function properly. And then you start to have gut issues, brain fog, emotions, and an increased heart rate. Some of the patients have POTS, which is postural orthostatic tachycardia syndrome. So it's all tied in. As the body takes information through neuroception, the vagus nerve communicates information to the brain, and it signals cues from the world around us. And it determines how we react through 3 physiological states. And I'm briefly going to touch the polyvagal theory very briefly. There's a parasympathetic or a ventral vagal state, a sympathetic state, or a dorsal vagal state. And the polyvagal theory, there is a book by Deb Dana, based on the work of Dr. Stephen Porges, Porges, and they talk about 3 hierarchical physiological states. parasympathetic or vagal state, which is your true self. When you are functioning at that level, there's social interaction, you're talking, you're feeling good, you're connecting, there's creativity, you're in good flow. When there's sympathetic state, and we sometimes need that in order to us to achieve things, there's this feeling of threat or danger and feeling the need to fight or fly or flee from a situation for safety. When you're in that sympathetic state for too long is when there'll be damage to the body, and when all of these constrictions that I'm talking about will start to settle in the tissue. But then there's another state called the dorsal vagal state, and that's when you're frozen. Perhaps there's been a terribly stressful situation and you've just frozen. It's like becoming possum and not reacting. And it's just freeze when you feel your life has been so threatened that you become immobilized. And polyvagal theory actually works with patients. There are therapists who work with this, and then there are special exercises to do for polyvagal to help get into different states. So I encourage you to read the book by Deb Dana, The Polyvagal Theory. Let's see if you can see that. It's a little bit hard with this background, but it's The Polyvagal Theory by Deb Dawson. A fun fact, although none of the drugs on the market, these anti-obesity, anti-diabetic drugs, target the vagus nerve, some of the anti-obesity medications may be working on part of the vagus nerve. Interesting. I know we've had a lot of chitter-chatter about these anti-obesity medications. So when there's high stress or anxiety, oh my goodness, high stress, adrenaline, cortisol, stress in your body, everything constricts. Oh, your vagus nerve can counterbalance this fight or flight and trigger relaxation. And stressors that stimulate the sympathetic nervous system by releasing cortisol, so your cortisol is released, noradrenaline and adrenaline, which actually stimulates the NF-kappa B, and that will then release inflammatory cytokines such as interleukin 6, and TNF-alpha. And when that happens, that causes cognitive and emotional behavior, and it will stimulate and if you stimulate the afferent vagus nerve, you'll have the opposite effect, and it's called having an anxiolytic effect. And this was a study done with my favorite thing, essential oils, showing how different essential oils can affect the vagus nerve and have an anxiolytic effect. Working with cinnamon can suppress NF-kappa B. Ylang and rose can increase serotonin to calm the body. Lemongrass and bergamot and also frankincense can actually help to lower blood pressure and heart rate. And rosemary, clary sage, and Roman chamomile can help with cognitive effects. So that's very interesting what you can do with essential oils. And when coupled with aromatherapy, with a polyvagal theory that I spoke to you about, they can be powerful tools to help mental and physical states. And essential oils have been shown to have a wide range of activity on the nervous system, including anxiolytic, antidepressant, sedative, and increasing calmness. This was a study done by one of my colleagues and actually presented at one of our aromatherapy conferences where I presented a couple of months ago. Heart rate variability is a dance between the sympathetic nervous system and the parasympathetic nervous system. And heart rate can be manipulated by breath. And when activated, the vagus nerve releases acetylcholine and slows the heartbeat. So if you activate the vagus nerve with a deep, quick breath and a long exhalation, you can help to slow the heart rate. The vagus nerve is a bidirectional conduit, and the heart rate is controlled between the dance of the sympathetic and the parasympathetic nervous system. We have something called psychomotor vigilance task and heart rate variability, which explain the relationship between breath, heartbeat, and the mind-body connection. I don't expect you to know all of this, but if you are interested, I have a reference for you at the end. You can look up heart math. It's extremely interesting talking about all this heart rate variability. But basically, inhalation speeds the heart and exhalation slows that and also helps with the vagus nerve. And most of the fibers in the vagus nerve are afferent, which they go towards the brain, but there is a connection between the heart and the brain. Interesting. The heart sends afferent vessels from the heart to the brain. And there are more ascending neural pathways from the heart to the brain than from any other organ. And this will help feeling self-induced positive emotions and help with well-being. This is the heart math that I told you about, and it helps to regulate you into a more coherent physiological state before, during, and after challenging events. So you go to your doctor and he starts telling you you have to lose weight and there's nothing wrong with you, and you really get upset. You can use this heart math system to actually ease that stress and optimize your mental clarity and help you during that challenging effect. Coherence is what I want all my patients to be, all of us. It's being in a harmonious state when our hearts, minds, and bodies are united in cooperation and flow. Personal coherence practices can calm your nervous system, neutralize stress, and help you make better choices. So again, I encourage you to look up heart coherence. We could do a whole study on each of these slides. And when you're in a more coherent state, then the autonomic system, there's more parasympathetic activity and vagal tone. And you increase your heart-brain synchronization and help to entrain the brain and help all the systems to function properly. When you're in this mode, your body can function with a higher degree of efficiency. So we do have lipedema and pain and inflammation, and so we need to actually adjust to that and be in a coherent state and be vigilant and work with rhythmic breathing so that we can actually help our bodies through these periods of stress. When you are in a coherent state, you're in a general sense of well-being. And we want to develop resilience. I love this word. Resilience is the ability to withstand adversity and bounce back from difficult events. It doesn't mean that you don't experience the stress or the emotional upheaval or the suffering. It just gives you the ability to work through emotional pain and suffering. And when we stimulate our vagus nerve, we send a message to the body that it's time to relax and de-stress, and we will help with resilience and with our mood. That's what my goal is for all of our patients. Resilience takes the form of emotional resilience, how you deal with a crisis, or physical resilience, ability to adapt to challenges and recover very, very quickly. These are some of the domains of resilience: physical, emotional, spiritual, and mental, with coherence in the middle. And we want to tone the vagus nerve for well-being. And one of the things to do, and I thought we would actually have time to do these exercises, but I think I had a lot to share with you. I'll have to just talk them through. But if you breathe slowly, in fact, let's just do that one now. I'd like you to breathe in 2, 3, 4, and hold 2, 3, 4, 5, and breathe out 2, 3, 4, 5, 6. And when you breathe from your belly, you expand your abdomen, you widen the rib cage, and you exhale longer than you inhale. The limbic system is part of the autonomic nervous system, and that is part of your emotional. And when you inhale, it goes directly to the limbic system, and it will trigger positive memories and emotions. So let's get back to inhaling. You could take this aromatic oil, say you have some rose or some frankincense, put it in your hand, rub your hand together, take a deep inhale, and you can either do the inhalation that I told you, which is breathing in for 4, holding for 5, letting out for 6, or you can do box breathing, which is breathing in for 4, holding for 4, breathing out for 4. The other way to tone your vagus nerve is to gargle, because your vagus nerve goes down the throat, and you gargle with water several times a day, which will activate the muscles in the back of the throat and activate the vagus nerve and stimulate the gastrointestinal tract. If you sing loudly or you hum, when you meditate and you go, you're stimulating your vagus nerve by vibrating down the throat. And of course, I love to laugh. And when you laugh, you lift your mood, you're boosting your immune system, you're helping your lymphatic system to move, but you're also toning your vagus nerve. So breathing in, as I mentioned to you, and then here is an exercise, and I did do this at the FDRS. Turn your head to the side. Well, let's do the left side. Place your right hand, turn your head, hold on, place your right hand over the head, face your eyes upward, take your left hand and hold it on your ribs and gently look up. And you hold that for 30 seconds. And then you repeat to the other side. You turn your head, you put your neck down, you hold your head down, you take your hand, you put it in between the ribs, you look up, you gaze up, and you hold for 30 seconds. You will tone your vagus nerve. And then there are exercises with the ear. If you stretch the ear outwards, stretch it down, massage the inner ear, massage, stretch it outwards, and then repeat the other side. You're also working on the vagus nerve because it innervates very richly around the ear. You can gargle, you can do a foot massage, you can immerse your face in cold water. When you eat fiber, it stimulates vague impulses, and again, a good laugh lifts your mood, boosts your immune system, and stimulates the vagus nerve. We have to laugh. We all have to laugh. So doing your deep, slow belly breathing will help limbic system regulation for mast cell activation, focus away stress, help the fight or flight. And again, you do your breathing, exhaling longer than you do inhaling. Push your stomach up as you inhale in, pull it in as you breathe out. And then mast cell activation can be improved when you are doing breathing, when you have parasympathetic nervous signaling. And I see I'm running very short of time. HeartMath talks about heart-focused breathing. So when you pay attention to the center of your chest, the area around the heart, and imagine that the breath is flowing in and out of the chest while breathing in a little slower and deeper, you will increase cardiac coherence, modulate vagus activity, and help your heart rhythm and help with coherence in your body. So the end of my story is listen to your body, manage the challenges of your life, and become resilient. If you struggle with painful memories, anxiety, or pain, be with that pain and then release. It's important to be with it and process it and then release. And I might be talking to many of you right now. Honor the incredible person that is you. Consciously breathe a few deep inhales and slow exhales. Get enough sleep, nutrition, relaxation, sunlight, meditation, and mindfulness. And to summarize, your fascia is a sensory organ and linked to your autonomic nervous system. Myofascial techniques can release trauma. Unresolved psycho-emotional conflicts or trauma can be stored in the fascia. The mind and body are connected through the vagus nerve. Emotional stress may influence myofascial pain and inflammation. The vagus nerve plays an important role in stress levels and the nervous system, and vagus nerve signaling will help reduce stress, inflammation, and mood. There is a connection between the heart, the brain, the vagus nerve, and the nervous system, and you can develop resiliency. These are some resources. Please take a picture of this. These are all for brain retraining if you have been through trauma. Very wonderful Gupta program, and then the neural retraining as well. And the heart math is fantastic. And I thank you so much. I know I gave you a lot of information. We've got 5 minutes left for questions. Thank you so much. And please, you can look at this again when you get the replay.
It was amazing. And we have so many people that are saying a lot of different things in chat as well as the Q&A. I thank you for your time with us, Linda. And that was amazing. I will say this, there was a question from the audience. Can we take screenshots and post them on social, giving you, of course, attribution and Lympha Press?
Yes, that would be fantastic.
Okay, Casey Grosvenor, go for it. We want you to be
Casey's the queen of the Instagram.
Casey's the queen of social. She is out there, and we have so many thank yous coming in from the audience. I want to, before I get to the questions, I want to just launch a quick poll. I'm interested to know who is out there today. Are you a patient or are you a clinician? If you wouldn't mind answering that poll real quick while we get to some of the questions. We know that there were people interested in this whole concept of trauma. You mentioned adverse childhood experiences. Someone wanted you to elaborate on that a little bit. It doesn't have to be just childhood.
No, it doesn't have to be childhood, but I actually listened to a very interesting webinar just recently on adverse childhood experiences and the effects on eating disorders. And my friend Marty Klein was the one who actually gave that to me. And it really showed when there is an adverse effect that happens in the system, it wires your brain differently and can contribute towards eating disorders, addictions, and many other things. And of course, that's stored in the tissue. It's a huge subject, ACE, which is adverse childhood events.
Excellent. Yes. And Kathleen Lisson wrote an amazing book about that. And she has spoken on that. There is a webinar that lives on our website that she gave. And so you can use that as a resource. So over 75% of our audience are patients, about 22%.
Wow.
So, our medical professionals. We're so honored and so glad that you are with us today. Thank you so much. Let's get to some of these questions. Wanada Ayers asks, what do you recommend for aftercare following this is not necessarily related to the topic of the day, but after lipedema reduction surgery, particularly anything related in the trunk? I will tell you this, aside from lipedema, we have a webinar coming up next month as part of our educational webinar series on the central lymphatics, which you will all find fascinating. I put the link tree in chat so you can register for our upcoming webinar on the central lymphatics. Any recommendations for aftercare following lipedema reduction surgery, Linda Ann?
Lots of recommendations. In my clinic, we work with a lot. We prepare patients for surgery and work with them post-surgery. Depending on the doctor and depending whether there's drains or not will depend when you will start. Some of the doctors have drains and don't want you to do anything till the drains are out. But manual lymph drainage is absolutely crucial a week to 10 days after the surgery. You don't want to be using your massage gun at that point because it's sensitive. Essential oil blends can be amazing to be anti-inflammatory and for the pain. There's a whole slew of supplements. A week after surgery, when there's not a risk of bleeding anymore, you can start taking, you can take arnica straight away, but taking turmeric, there's a lot. But the lymph massage lowers sympathetic activity, which I've been talking about a lot today, and helps to calm the nervous system and helps with the pain. It has a pain reduction as well as helping with the inflammation. And then you must wear the compression.
And speaking of pain, of course, this webinar is sponsored by Lympha Press. If there's anyone in our audience today, we know over 75% of you are patients. I can say from my heart, so many lipedema patients have experienced a reduction in pain. And you may not even term pain what we think of as a sharp shooting kind of ouch. The achy heaviness in your limbs, using the Lympha Press pneumatic compression, the Optimal Plus with the pantsuit, and we have the upper extremity garments, can so help to reduce pain and increase mobility. We would be honored for you to reach out to us. Please do, marketing@lymphapress.com. We would love to help with pain. Carol Moody asks, does it help to take collagen? She's had cervical microdiscectomy and a scar across her neck. So is there anything else that can be done to help an area like this when there is scarring, etc.?
I do like collagen. I take collagen powder every single day. Some people don't want to take animal protein, so there is a marine collagen. It doesn't work quite the same way because you want collagen 1 and collagen 3 for that. We haven't really seen a lot of research. What is it really doing? But we do believe that it's going to be helping. But the scar tissue that's formed from that surgery, you might want to try myofascial release, could be very helpful for that, or cross fiber, with your lymphatic therapist. And if it's been there a long time, there are essential oils to help with scars, but usually it can be more recent scars.
There were some people in chat expressing the challenges that they're facing, and we understand. We know that managing lipedema can almost be a full-time job. We hope that you're using every tool in your toolbox. And thank you, Linda Ann. You reviewed so many of those tools today. So we don't just say the questions and acknowledge the chat without understanding that this is hard. And we empathize, absolutely. So one question came in from Fiona O'Brien. Fiona, thank you for being with us today. She is lipedema stage 4. She had an incident where her heartbeat went crazy, and she's been taking her blood pressure at home. So she put her cuff on, her blood pressure went low and the pulse was double. So then she did a quick breathing technique, just like you suggested, which calmed things down instantly. She asks, do you think this could be related to the vagus in any way?
Absolutely, because you've stage 4, that's lipolymphedema. So there's lipedema with fibrosis, there's lymphedema. In all probability, it's hard for you to walk, be mobile, be part of your life. So there's a lot of stress. It could be, of course, we don't give medical advice here, but we can give recommendations, of what we think. So it definitely could be. If that heart rate is continuing, you might want to check out postural orthostatic postural orthostatic tachycardia syndrome. It could be that, but it definitely could be vagus. And doing all the techniques for calming and moderating and aromatherapy would be wonderful. I think essential oil of frankincense would be wonderful just to calm your nervous system.
Excellent. We've been asked to stop screen sharing because people want to see your eyes and face more. So we will comply with that, but we hope you got Linda Ann's information. She is in the San Diego area and helps patients, is devoted, one of the most devoted lifelong learners I have ever met in my life as well. And we all benefit from that. Lonnie Lane asks, is ADHD common with lipedema patients?
Well, it's interesting that you're asking that. One of my heroes, Dr. Alexandra Amata, who's from Brazil, just did a study showing the connection of ADHD and lipedema. Alexandra Amato, how's it? AMATO, Alexandra Amato. Yes.
Interesting. We may have to do a future webinar on that. That is fascinating.
And I think, as we learn more and more and more, we're going to find more of these things are linked and connected, just like dry eye syndrome, flat feet, pronation, all of these things.
Yeah. Wow. Okay. Totally different question, but it's about how it impacts the fascia, which is, how do chemotherapy and proton beam radiation affect the function of fascia?
Yeah,
Excellent
so
question, Lisa Brady. Thank you.
so proton is a more direct radiation, and so it doesn't go all over the tissue. But I have found that my patients who have had that have had more fibrotic tissue. And yes, I haven't seen it in literature, but I'm just telling you that could definitely affect the fascia and affect constriction. And then regular radiation, they have improved the beams a lot, but it does cause lymphatic dysfunction and does affect the fascia. So as soon as everything is healed, you want to do your lymphatic massage, absolutely. And myofascial can be very helpful as well.
So there is some chat and also a question about, first of all, how do we get more practitioners engaged? Dominique Campbell wants to know that. There's too many remaining uninformed. We do our best at Lympha Press to help educate and raise awareness about lipedema and about groundbreaking research and where is the field going, introducing people like you and having our platform used for that. But how can we get more practitioners engaged? An excellent question. And another follow-up about Atlanta, Georgia in particular. And Nikki, I would say to you, please reach out to me and we can connect you with our Atlanta representative for Lympha Press, who is connected with many excellent therapists. And, you know, that's a great resource. Use us, use Lympha Press as a resource. We will connect you to our local rep who has a network of medical professionals that can help. Contact marketing at lymphapress.com or bviola at lymphapress.com. I will put that in chat and I will let you answer the question about how do we get more practitioners involved, Linda Ann.
So for 22 years, I hosted classes and I brought a senior teacher from the Dr. Vada School, my dear friend, Catherine, and she taught. And we had people coming from all over the country to train. She's retired, and I don't do those trainings anymore, but it is a problem. I am now going to I have 2 people in my clinic who do the work. I'm sending one of my other therapists for training to complete her training with Gunter Close, actually in November. There's not enough. I just had a patient yesterday who said there's a 5-month waiting list at the hospital and she couldn't wait. So she's coming to me and I work closely with the girls in the hospitals. It is a problem. We need to educate more doctors, more physicians, more practitioners, and then of the lymphedema therapists that are working, they don't all know enough about lipedema. So please, all of you, educate. If you do go to a therapist who doesn't know a lot, give her all the materials, give her all the lists. I'm on a lipedema education group. We meet every week. Our goal is to get information to all the physicians. So it is a problem. We need more therapists.
And the standard of care for lipedema in the United States was a groundbreaking document, one that will continue to be updated. But Linda Ann Kahn was part of the team that put together the standard of care for lipedema in the United States. It's a document you can bring into your medical professional. Download it from the Lympha Press website. It's also posted. It's open source, so you can pretty much get it anywhere. Just Google standard of care for lipedema in the United States. And you know, unfortunately or fortunately, many patients have had to be their own advocates, to have had to educate their own medical professionals. We support you in that. We also support you by having our monthly roundtables. If you have never attended a lipedema patient roundtable, we just had one last night. They are on the 3rd Wednesday of every month. There are patients just like you that are managing their condition effectively. We talk about Lympha Press, but not just about Lympha Press. And Linda Ann is often at the panel. What would you say about those roundtables, Linda Ann?
It touches my heart. The people who are in the audience, you know, who are giving in comments all the time, and the panelists. I've been on this panel, I think, for 2 years now, and I will tell you that I look forward to the Wednesday nights. I can't always go. Sometimes there's patients and things that happen, but they are so amazing, and it creates a feeling of it's a community. And whenever I have new lipedema patients, I give them the link to join the roundtable because it is a community. Thank you for creating that.
And when you have something like lipedema, yes, it's a physical condition, but as you so beautifully outlined, it has mental implications and emotional ones. And so at Lympha Press, we don't just want to support you in your physical journey. We want to support the emotional journey as well. And that's what the roundtables are all about. You can go up to, in chat, there is a link to the Lympha Press link tree, and you can register for all of the upcoming roundtables. We do for lymphedema and lipedema. And since this is Lipedema Awareness Month, we wanted you to make sure that you knew about that. A question in the Q&A from Roseanne Hebert. Thank you for being with us, Roseanne. And I might not say this correct. You said so many difficult names so beautifully, Linda Ann. Methotrexate?
Mm-hmm. Yeah.
Okay.
So methotrexate is usually given to patients with rheumatoid arthritis, but sometimes it is used as an off-label drug for Dercum's disease. It's off-label. So I have found out that long-term use of methotrexate can cause pulmonary problems. But my patient who's on that it was for 25 years for her rheumatoid arthritis. She did develop pulmonary. So I don't believe it's something you should stay on forever, but.
So we have kudos coming in from everyone and heartfelt appreciation from Lympha Press for sharing your wisdom. Are there any closing words that you would like to leave with our audience?
I just want to say that I know I was giving these big words and long things that I was talking about, but I really care and I really feel what patients are going through. I went through a lot myself, nothing like some of my other patients in later stages, but please be resilient, learn about coherence, learn about being resilient, incorporate some of these things we spoke about today into your daily lives, because it can help you tremendously. And then reach out to a community. You're not alone. You're really not alone. And remember, we say this sometimes in the round table, you are more than your legs.
Mm-hmm. Oh, beautifully said, Linda Ann. Thank you so much. What a beautiful way to honor lipedema patients and the medical professionals who treat them for Lipedema Awareness Month. Although every month at Lympha Press is Lipedema Awareness and Support Month. We thank you, each and every one of you, for taking time out of your busy schedules to be with us. We will continue bringing you great content. You can get the replay, of course, if you registered, you will be sent a link. Everything is always posted on our website or on our YouTube channels. And with that, everyone, have an amazing day. You are seen, you are heard. There is help and there is hope, and we're happy to be a part of that. Have a great day, everyone. Bye, Linda Ann.
Thank you so much.
Thank you.